Guys, welcome back to the D&N Medical series. I'm back with a brand new video, and today we're going to talk about labor. Alright, so what are the signs of labor? How to tell that you are in labor or you're not in labor. This is very important because we can have what we call a true labor as well as a false labor, and we're going to talk about that later. Also, labor can occur at any time during the pregnancy because you may have a premature labor, which means that the baby can come before the 37th week of pregnancy. But if you're doing the 37 week to 42 weeks, these are signs that you are supposed to look out for. So one of the initial signs is that your water broke, or what we call rupturing of the membrane, and it's basically liquid that's coming from the vagina, usually the amniotic fluid, and it can be clear or white in appearance, and it may be slimy. So if you find any discharge or any liquid coming from your vagina, then it's time for you to check out your doctor. Although this is a sign of labor, you can also have rupturing of your membrane, or what we call your water broke, and you're not in labor, and this can increase your risk of certain things such as an infection. So you want to check it out with your doctor as soon as possible. Alright, so how to know that you're in true labor versus false labor? There's something called a bloody show, so you may pass blood or mucus or slime from the vagina. That's also a sign of labor. True labor also include contractions. So if you're having regular contraction, which means that they're coming around the same time, they're very intense, then you may be in labor. Usually for labor, you will have at least one contraction per 10 minutes for at least an hour. Also, with the true labor contractions, the contractions increase in intensity when you walk. So as you walk, the pain or contraction increases, right? You can have abdominal pain in the lower abdomen, so below your navel or your umbilicus as we may call it, and you may feel the pain in your back. All right, this is definitely labor pain. Also, you can have dilation of your cervix, so you may present to the hospital and the doctor may do a vaginal exam and check for the dilation of your cervix. Usually if it's more than 4 centimeters dilated, then you're in labor, and the maximum dilation is usually 10 centimeters. Also, the fetus may prepare for labor, so their head may be low and it is located in the pelvis, which is what we call engagement of the baby. Alright, so false labor now is quite the opposite. So the contractions are not regular, so they will come in at different intervals, so 1 per hour, then another 2 hours pass, and then you feel it again. So it's not that regular, it's not so intense. You may feel pain in false labor, however the pain is not in your lower abdomen, but it's above your navel, and the pain is not in your back. Also, if you should present to the hospital and they do a vaginal exam, there'll be no changes in your cervix, so your cervix won't be soft and ready for labor, as well as it won't be dilated, so you won't have any dilation of your cervix. So that's it for this video, guys. Remember to look for the signs of true labor versus false labor, so ensure that you're actually in labor, and if you're not sure, you can always visit your doctor. All right, that's it for this video. See you in the next one. Goodbye.